So my name is Jenna Carter, and I am an at-large council member for the city of Bloomington. My family and I first got tested for COVID-19 at the end of October. We found out that through our learning situation, our childcare situation, that somebody we were in direct contact with had tested positive for COVID. At that time, we really didn't have much for symptoms, but we immediately quarantined and then decided to go to one of the state saliva testing centers, and that's when we got tested. And found out the next day, actually, that our 6-year-old Evelyn had tested positive. I was pretty surprised that my daughter's test result came back positive. You know, she had been a little bit more tired, maybe a little bit more crabby, but it just was really scary, I guess, especially since we don't really know about the impact that it has on kids. And at that time, my son and I actually tested negative. And then when we did retest 3 days later, we were all positive. My husband and I did start to have symptoms. We had really bad sore throats, and we started to have a little bit more tiredness. And from there, the symptoms continuously got worse. He started getting a lot better, and then I started feeling better, but then my symptoms came back even worse. And so, you know, I worked with a doctor, testing my blood oxygen level every hour at home and, you know, reporting my results back. Being monitored by a doctor. Thankfully, I didn't have to go into the hospital, and thankfully my symptoms slowly did improve. My breathing is still not back to what it was before, and so, you know, hopefully I feel confident that I will get back to 100%, but, you know, as somebody that's active and young, it's a scary thought to think that there can be some lasting impacts. One of the biggest challenges, I think, with COVID, especially for families or for people who are working right now, is, you know, balancing our kids' schoolwork and working. And so we were really fortunate to be able to figure out a childcare situation. And we were thinking that our bubble was pretty small, but, you know, after the fact and upon reflecting and talking and having conversations, we realized that our bubble was much bigger than we had thought. And we're to a point where I think we're realizing how much that's impacting community spread, and that we all just have to be so much more careful and so much more cognizant about that simple fact that we might think we're having one conversation with one person, but really we are exposing ourselves to a lot of other connections in the community. We're even more determined to be more careful and to make sure that, you know, we're not unnecessarily exposing others to the virus. We're not going back to Iowa, where all of our family is, for Thanksgiving. We just want people to understand that COVID can impact anybody. We're a young, healthy family. We have no underlying health conditions. And we were really taken down by the virus. I mean, I didn't work for 3 weeks, and fortunately, I'm in a job that provides paid leave, but many in our community do not have that benefit. I just want people to understand that the impacts of this virus are real. As a city leader, your city is here for you. We have a lot of resources that are available to people living in Bloomington. We have a COVID-19 resource page, whether it's food or medical supplies or financial resources and support, or you need to get connected with a person to talk to figure out exactly what you need. The city really is here for you. We're all doing our best, and the more that we can, you know, treat each other with kindness and understanding and compassion, I think the better it will be for, you know, all of us in getting through this.